Hey, Kara. Hey, everyone.
Hello, are you ready to go?
I'm ready to go. One of my favorite
Okay,
topics, KPIs.
awesome. Well, let's do a brief introduction just in case we have new people on here, and for those that are listening via recording. I'll go first quick. My name's Kara Welke. I'm an occupational therapist. Started my own private practice in 2018, which is when I first met Steve. And Steve and I started helping therapists start and build their own private practice since 2019, and we've helped 300 plus therapists start, build, and grow their private practice. And we are doing private practice power hour sessions third Friday of every month at noon. So that's a little bit about me. Steve?
Hi, my name is Steve. I am an occupational therapist and I am the CEO of HelloNote. So, yes, when we met Kara, we had the idea of coming together, joining forces, and not giving therapists a burden of having to figure everything out on their own to start a business, because we did the dirty work ourselves. So that's why we want to share the knowledge. And that's one of the reasons HelloNote is in existence. We want to make sure that therapists have an EMR system that is functional and affordable. And we're very community based, so we listen to feedback and we make sure that we apply all the updates based on the needs of the clients, not just based on random things that come up. So we are compliant with Medicare for self-pay. So there's tons of updates that we do, including for marketing. And my role as the CEO and then occupational therapist, I work with PT, OT, and speech therapist. We collaborate to give the best possible EMR that we can. And being in the industry really helps a lot, so we can identify those pain points and make sure that we help others with their pain points.
Awesome. Okay, so today's overview, um, again, we're going to be focusing on KPIs. So I have found that a lot of people don't know and understand what KPIs are, meaning key performance indicators, and that's completely fine, but they are very important. When I first started my practice, I had no idea. So our goal is anyone we work with, we make sure we assist them with identifying what's appropriate for their practice and getting their KPIs up and going so they can make those important decisions based off of actual metrics rather than just guessing. So today we're going to be identifying what KPIs are and why they're important, as well as to be able to identify the 7 key KPIs. And yeah, whether you have just started your own private practice or considering it, it's just essential that you guys know and understand what KPIs are so that you can measure the health of your business. And why do they matter? They're a measurement of activity that can be quantified and are critical to the success of any business. They help you set performance improvement initiatives and provide you with data to compare your clinic to industry-wide benchmarks. I'd actually posted a question in our Next Level group today regarding denial, or well, what was the specific question? It was about like the average rate of denials for a private practice. And we find that a lot of private practice owners don't even know what their own rate is. And with the systems we use, we're able to identify that so we know where we're at according to the national average, as well as we're able to identify what we need to do better in our practice. And they need to be measured regularly and some we do weekly, some we do monthly, some might be a little bit more spread out by that. And Steve, do you want to talk about with the how is your practice doing, and a little bit more that you want to talk about on KPIs before we get into the 7 key ones?
Sure. So KPIs, I always say, is like the health of your business, right? Without KPIs, you don't really know how to measure and track your business, right? So similar to you identifying goals and putting goals for your patients, long-term and short-term, you should be doing the same thing for your business. So those goals are your KPIs. So you measure them by having something in place, and there's no like one size fits all here, right? You can have a lot of different KPIs that you come up with, and that measures the success of your business. Of course, there can be overlap with other similar businesses, but everyone operates their business differently, and there's no right or wrong. So if you want to keep track of how many evaluations you did per month, there's nothing to say that that's wrong because somebody else is keeping track of how many evaluations they're doing per week, right? So it just really depends on the volume, the pace of your business, also how many disciplines you have. Like for example, if you have a practice with OT and PT, you shouldn't just measure evaluations, right? You want to get a breakdown of how many PT evaluations, how many OT evaluations, and then how many follow-up visits for each, and so on. So those are KPIs. It just allows you to drill down and measure key elements of your business. So this way, over time, you can look back and say, okay, my business grew, or my business did not grow, or my business stayed the same. And based on those elements, you can identify time, as far as like maybe in the summer you have lower evaluations versus the summer, or referrals, whatever you're tracking. So without KPIs, you can't do that. And I speak to a lot of business owners, and I know Kara does as well. As she said, people don't know what KPIs are, nor do they think that they're important sometimes. They're excited to start a business, but I always say start KPIs right away. Even if you have a short-term goal, a very low short-term goal, and short and long-term goal, it's important just to put something down. And even if you don't hit it, that's okay. That actually allows you to grow as a business owner, so you could see why you didn't hit those KPIs, so you can make adjustments to hit them.
So in the comments section, and you don't have to do this, but just write it down for yourself. When someone asks you how your private practice is doing, what would you say? And how would you know what your response would be? If it's good, so, not so good. We have therapists come to us and say their practice, is going well, but then when we start breaking down the KPIs, they're not able to tell us, how many visits they have per month, what's their income that they have, what's their cancellation rate, all of those different things. And it's just so important to be able to know the health of your business, as Steve mentioned. So baseline KPIs. Before we get into KPIs that are specific to your goals in your practice, it's important to know that there are certain things you should be looking at on a regular basis, such as monthly insurance revenues, monthly patient revenues, total visit count. My mouse is being funky today, everyone. And picking KPIs is actually, or with the baseline KPIs, picking KPIs is actually a secondary question. The primary question is what are your goals are, as Steve mentioned, where are you trying to go, and how are some examples of goals that one may have for a practice. Are you looking at massive growth, moderate growth, steady growth? Are you looking at staying level? Are you looking at winding down for a retirement? And this is really important too, where on some of the presentations you guys, some of you have been on over the last few weeks, we talk about how everyone's practice is completely different. Everyone's KPIs are going to look different, but you need to know where you're going. And a lot of people don't really even have a plan. So if you're going to be having a clinic, say you're mobile, are you going to stay mobile, or is your long-term goal to have a clinic? So what you're measuring is going to look a little bit different. Is your ultimate goal to grow as big as you can and add multiple disciplines? If so, that's going to look different. Versus we have some therapists that come to us and they just want it to be themselves. They don't want to have massive growth. They just want to be able to stay steady, and that's all they want to deal with. And then we have some that come to us and they really kind of want to actually taper down one service and increase another. So all of that's going to look completely different. So here are the 7 KPIs that you should be tracking. And Steve, I'll let you take it from here.
Awesome. So these are just some sample KPIs that we put together that you should be tracking. As we go on, you'll see some of them will get a little more complex, but these should be at least your baseline. So for example, for this one, this is visits per new patient. So average number of visits a new patient is seen in your practice, right? So it is important to keep track of your new patients, right? Which in turn are your referrals. But sometimes referrals, you won't get a new patient only from a referral, you might get it from another source, right? It could be a returning patient, but you want to keep track of that. So this is specifically for a new patient, how many visits are you having? So this metric provides you with a quantifiable and objective number of how long each patient was treated in your clinic. For an outpatient clinic, you typically want to aim for 10 to 12 visits per patient. For a specialty clinic such as chronic pain, sports medicine, target number of visits is likely going to be higher based on the amount of care patients with these diagnoses require to return to their PLOF, right? So, and that makes sense, right? So depending on the type of model you have, your goal for visits per patient is going to vary. Like for example, we have clients that do just wheelchair evaluations, right? They're not going to have a ton of new visits, right? They're just going to have that one evaluation, and then of course, for like neuro, you might have higher and so on. So this is an important metric to track, at least as a baseline.
This is one of the metrics that we use when we're helping therapists with their overall financial numbers as well, because it makes a difference to know how many new clients they need to get in per month with that. So we're always looking at what is that average visit rate, because it helps us with, a lot of things with the marketing, referrals, things like that as well.
Yep. So next one is the arrival rate. Arrival rate is the percentage of patients who showed up for their scheduled appointments. This is a crucial KPI because you want to know how many patients are showing up to their appointments, especially if it is a treatment session, as no-show and cancellations can disrupt the plan of care. This can also have a major impact on your therapist's daily productivity, your clinic's overall revenue, and your clinic's future growth. So I just want to pause there for a second because there's a lot to dissect there. So, you work hard to get referrals, to get patients to come to your office, right? And then all of a sudden, out of your, let's say, 10 patients scheduled for the day, 2 patients don't show up, right? So, if you schedule them 1 patient per hour, that's like 2 hours that you just lost. And that's not only affecting, your KPI, that's directly affecting your revenue. So it is important to realize that KPIs help you identify revenue loss. And think about if you have a therapist that was supposed to treat that patient, and now their patient didn't show up, right? Are you still going to pay them? If they're, depending on your agreement with them, you might still have to pay them, right? So that's important to know. And this is what I mean by we learn by pain points. So HelloNote has a feature called the waitlist fill gap. So any patients that do cancel or no-show, you actually can keep track of your waitlisted patients and quickly send them a message that you have an available time slot for them. But we're going to have a separate call on that. I'll showcase that. But as far as the KPI goes, it is extremely important to keep track of no-shows and cancellations. Okay, and I would personally track this separately. So no-shows are patients that just never showed up, right? That's important to know because honestly, like with our office, we give them like 2 chances. If they don't show up on the second, if they do have a second no-show, then we don't prioritize them for scheduling. Again, because there's other patients waiting to be seen, and this patient doesn't show up, they don't value their treatment, they don't value your time, and that impacts your revenue, so that's important. And cancellations, again, that happens, right? Cancellations happen. Patient has, another doctor's appointment or something like that, or transportation issue, or just unexpected emergency, or they just didn't feel well. So it happens, but at least 24 hours in advance is important. And again, that's just what we do. You can, others I know have 48 hours in advance. So it is really important to track that rate. And again, the reason you want to track this over time is because you could see like a pattern, right? So sometimes we actually see in the winter time there's a lot more cancellations than in the summertime, right? And why? Depending where you live, there could be snow, severe weather, and then you can actually throttle and not have an extra therapist on hand during that time could save you money. So you don't have to hire an extra therapist during maybe that seasonal period, depending on how your business is. So then next thing is knowing these numbers can help determine changes that should be implemented in the future to increase the number of patients who show up for their appointment, while subsequently decreasing the number of no-shows and cancellations. So the goal for this KPI is to get your no-show and cancellation rate to 0, right? You don't want a cancellation and no-show. And things like appointment reminders, those are important because those get sent out to the patient prior to their appointment to make sure that they know about their upcoming appointment. Okay, and if there's a patient that is a no-show cancel, then you have to call them and say, what happened? Please make sure, next time you inform us or notify them of any policies that you have. And I know plenty of clinics have a fee that they charge to patients that are no-show or cancel or repeat offenders.
And just to chime in with an example, one of our clients that has had a practice up and going for a long time, we met a couple weeks ago, and after implementing the systems and automations and making some changes to the policies and procedure, their cancellation rate reduced by 10%, which is huge to add increased revenue for their practice. Okay, next KPI. Steve, you want to start with this one again?
Sure. So this is visits per full-time equivalent employee. So again, the KPIs can get deeper, I guess, not something simple as no-show cancellation or how many evals or referrals. You can also track them based on higher kind of more in-depth metrics like visits per full-time employee, right? Because when you have a full-time employee, they're expected to have a productivity where they see a certain amount of visits per week, right? Or per day, however you structure it. So if you don't hit that, it impacts your revenue directly because you're paying them for their time and you want to maximize the output of the therapist that you hire. So again, a lot of clinic owners don't realize that, and I have some examples, and even with us, like running a practice, sometimes we have an employee, a full-time employee, and then when we run numbers, we realize, what, if they schedule patients a little bit closer together, they can see an extra 1 to 2 patients more because we're paying that therapist for that time anyway. So we might as well get another patient in there or more than one patient in there and maximize billing to increase revenue. Again, this depends on insurance guidelines or whatever it is, but it is important to understand this metric as well. So a full-time equivalent employee is any therapist who works full-time for your clinic. This metric will help you to view the clinic as a whole and to determine the next steps for your clinic. Next steps should include gathering more referrals or needing to hire another therapist to ensure patients are receiving adequate care. So off of what I said with maximizing revenue per full-time employee, you also want to make sure that you're not spreading your employees too thin by giving them too much work, right? So this allows you to also keep track to say, well, you know what? Now I have a need to hire an extra employee. Maybe not another full-time, maybe a part-time, and then that can grow into full-time. But this metric is important so you could see exactly how many visits your full-time employee can do on a regular productivity level.
And then an example just from working with clients, we have some therapists come to us, and once we have them run these numbers through some of our spreadsheets, they end up finding that they're actually losing money on therapists and need to even maybe change the way that they're paying the therapist, or make some big adjustments. So it's really important to obviously know these numbers. Okay, cost
Yeah.
per visit.
So next one is cost per visit. So this is a good metric to measure each month as it provides a rough estimate as to how much it costs to treat patients in your clinic. Be sure that when calculating this metric, you're including all clinic costs, including cost of payroll, benefits, equipment, supplies, essentially, utilities, documentation, software, and anything else that you pay to keep the clinic's door open and your employees happy. So you really need to know if your clinic is making money, right? Because Kara, I know you as well, you speak to therapists and they're actually losing money running their business, right? So that happens a handful of times where I speak to therapists and we look at their numbers, and at the end of the day, it's like they might as well just be an employee somewhere because they'll make more money than operating a clinic with like even 3 to 10 employees. All that stress and everything they're doing, they can just be an employee, make more money, without the headache of or the stress of running a practice, especially their practice because they're losing money. So typically I don't recommend here just get out of business and go work for someone. We identify why you're not making money. And sometimes we tell them, look, you have to let some of your staff go because they are the reason you're losing money because you can optimize so much stuff. As far as costs go, so like payroll is a big one, right? I speak to many offices who have like 1 to 2 extra staff members, not therapists. They're just staff members, like not doing anything. They're just doing something that another team member can do as long as you optimize the time and you train them. So it's important to realize that because having more employees is not always a good thing. It's maximizing the output for each employee and properly training them. And you also don't want to give your employees too much to do. It's good to have people wearing different hats. I'm a believer in that. However, you don't want to give someone too much stress because that can actually work against you. Other things like equipment, like so many times I speak to clinics and they have all these equipments and all that, and they don't use them. Therapists don't use them. So that's another thing. Like, maybe you should sell that equipment, or maybe you should use that equipment, and maybe that could go into like a cash pay, because a lot of insurances unfortunately don't pay for some treatment modalities. Utilities, I mean, you really can't do much with utilities there, but like software, like for example, HelloNote, we have a bookkeeping tool within HelloNote. We have a clock in and out tool that a lot of our clinics use, and it saves them money because they don't have to purchase something separate, right? There's just so much stuff from our end we're trying to include to save you money from having to sign up elsewhere. And I did just speak to somebody who was using our clock in, clock out feature, and they're saving $200 a month because they didn't have to use a prior system that they used before they switched to HelloNote. So, and that's awesome for us to hear because the goal is to save money and we want you to make money. Okay, but you need to understand that making money doesn't just mean more patients, right? Because I think a lot of times that's what clinic owners focus on, like, okay, more patients, more patients, more patients, but you got to actually look at your business, dissect what expenses you have, and keep your employees happy and yourself happy, right? You don't want to run a business unhappy because that goes to your employees and essentially goes to the patients.
And the only thing I add on this is if you don't know your cost per visit, and some people don't even know how much, their average reimbursement is per visit, that can really create some problems. And then Steve mentioned about like the electricity and things like that. If you have a clinic, we've actually had therapists that after running their numbers, they realize that they do need to make some changes, and with the clinic and the high cost of either the rent or the electric bills and so forth, that they've even transitioned clinics to be able to save money to help reduce that overall cost per visit.
Mm-hmm. Yeah.
Which
Yep.
then we go into the next one, revenue per visit.
Revenue per visit. So this metric helps you understand the amount of money on average your clinic earns from each patient visit, which plays a role in making a profit in your business. Revenue per visit can also help you determine other key benchmarks, such as revenue per therapist, to determine if your therapists are effectively managing their time and billing. So this one's important because again, you want to know how much revenue your patient is bringing in along with your therapist. So in HelloNote, and this might be a tough metric to track. So in HelloNote, if you run the revenue report, you'll notice that we actually added a column, like not a column, a filter for therapist and patient. So you can actually run this number and you can see what revenue you're making per patient and per therapist. So I do recommend tracking that.
Yeah, this is a huge number. Along with AI automations, with the tools we use, I'm able to see on a daily basis what our average revenue per visit is, which is great to be able to track. Okay, net income. Steve, you want to start with the net income? You're muted.
Sorry, can you hear me?
Yep, now we
There
can
we
hear
go.
you.
All right. So net income, one of the most important KPIs and measures of business performance. Net income is the overall profit your company has made after you deduct all expenses, including taxes that you paid for throughout the year. So just to pause there. So revenue is everything you make, right? So that's just, like gross revenue, for example, right? That's, you have to pay taxes on top of that, and that's not what you take home. So net income is what you actually made. And this is where, going back to the prior one, this is where a lot of people say, okay, I made, I made $100,000, $200,000 in a year. And then after they deduct everything, they actually barely took home anything. So this is why it's important to know what your net income is. So net income will show whether you are in the red or the green, and will also help you financially plan out next year's goals based on where the clinic ended up at the end of the year. Just remember, if your practice is in the red, on average, it takes 2 to 3 years for a business to become profitable. So this last section here, I don't consider that to be true. That's just more for like general businesses, right? But for therapy businesses, we've turned clinics around much quicker, like within a year, even 6 months. Just making some adjustments, you can definitely be in the green.
Yeah, and especially if you get started on the right foot and know what you're doing and get the proper things set up. With mobile practices is where I see that we can get people up and going and having a positive net income, a lot sooner. And then they're able to build up their reserves, so then they can add on staff quicker, as well as, look at expanding with the clinic and so forth with that. And then net income, then we also are looking at, the actual percentage with your profit margins and so forth. Okay, next one.
Awesome. Next one is new monthly patients and discharge patients. So your new monthly patients, evaluate how many new monthly patients you are booking and decide from there what your goal is to be for the following month regarding new patient visits. And discharge patient visits is these are the patients that have completed their therapy with you. How long did it take them? How efficient was the treatment plan? So again, these are good metrics to track, and they can help you get an average number of visits, which affects I think it was the second KPI we spoke about. So it is important to know how many new patients you have, as well as your discharge rate and how many sessions patients have on average.
And then as far as systems and automations, making sure you have a good system in place to follow up with these patients that are being discharged, and then also tracking that metric to see how many discharge patients you end up bringing back into your business with your discharge automation sequence. Okay. Steve, you want to sum it all up, I guess?
Sure. So by regularly measuring these 7 KPIs, you and your clinic will be on track to meet those business goals you set for yourself. And again, these are just 7 baseline KPIs, right? It doesn't mean that these are the only KPIs, or even some of them maybe don't fit your business needs. But it is important to identify which KPIs are important for you and identify for yourself your exit plan as well, right? Because I believe that identifying an exit plan for your business will help you track your KPIs regularly, because it really matters. Because if your exit plan is in 10 years to sell your business or hand it off to someone or have a partner, you're not going to be able to do that without having regularly tracked KPIs, right? Because nobody's going to come into your business and look at it and say, oh, well, okay, you're making $100,000 a year. Great. What did you make last year? And you have no idea, and so on. So it is important to keep track of it and start as early as possible. And even if you have a business now, it's not too late to start, right? So you can start tracking KPIs at any point, but the earlier into your business, the better.
And speaking of that, we work with therapists at all stages. Some come to us when they're first getting started, and some come to us after being up and going. Sometimes the therapists that are just getting started, they don't really know and understand why they have to do this. And sometimes it's kind of tough. They're like, well, I don't even have any clients yet, or I'm not even making a profit yet. So they, don't really see the importance of getting it up and going. But again, really sitting down and looking at your goals and where you want to be and getting your KPIs set up so that you can start tracking them, then it helps you to make important decisions down the road. So we're always making them establish some of these primary KPIs right away, even if they don't have very many clients or they're hardly making any money yet. Awesome. Amy, for those of you that are on live, do you guys have any questions on KPIs? And Steve, do you have anything else you want to talk about regards to KPIs before we sign off today?
I think we mentioned a lot. I think hopefully we reiterated how important it is to track KPIs. So just going back to what I said, like, you treat your patients, you provide them a care plan with long-term, short-term goals. Your business should be no different, right? So your business, it's a living, breathing entity, right? So you have to make sure that you nurture it throughout its life cycle, and keeping track of the health of your business is very, very important. So another recommendation, what I can make is, even if you don't want to track complex KPIs or something, just put one KPI together. Just something. Just start somewhere, and I guarantee you, over time, whether it's like 3, 4, 5 months, you're going to be interested in your numbers. You're going to see the fluctuation. Like with our KPIs, when we do them, I actually have a column in Excel that we track the delta from month to month. So you could actually see, based on the last month, how current month is. So if there's too big of a fluctuation, then you're like, okay, what's going on? Either a good way or a bad way. Maybe it's a good thing. Maybe you had, 100% more referrals. So that's a great thing. What did you do differently? Did you hit up the phones more? Did you go to different doctors? Did you do a speaking event? There's so much that could be done. Or the opposite. What if you had 20% decrease in referrals, right? What happened? Why? Let me call my referral sources. Let me see, like, what's going on. Now, again, sometimes it's not a real cause for alarm. If it's 1 month, 2 months, or something like that, that's fine. Things happen. But what if you start noticing over 1 year, every single month is on the decline, right? Then you got to wake up, you got to do something about that. And then again, that's just one KPI to track. And then if you add more, then you have more to work with. Okay. And all of that actually are like legs for your business to stand on. So I do believe that you should have at least seven KPIs. But if you have to start with one.
100%. I just can't stress how much more confident you'll also be in your business and in the health of your business by knowing your numbers and being able to make those decisions. And KPIs and getting appropriate systems and automations in place will really help you in the long run, if you do it sooner rather than later. I don't see any additional questions that are popping up in the chat. So, Steve, you want to share your email and how to reach out to you?
Yeah, absolutely. My email is Steve, STEVE, at HelloNote.com. You could always reach out to me. I'll be happy to connect with you. And yeah, I'm always happy to discuss your business, whichever direction you want to take it, whether you're a new business owner, whether you don't even have a business and you want to start one, or if you already have a business and you just want to chat about how you can make improvements and grow your business. And that's what the Therapy Business Builder program is all about. We want to help you grow your business and be successful. And we're a community of therapists, and we want you to also help other therapists as well. So we're building a community of knowledge and network.
And my email is Kara at nextleveloccupationaltherapy.com. If you have questions about our programs or things we do, you'll get an email with our information as well as the PowerPoint. So you guys can pull this up and look through, because I know we had a lot of written language on that, but that was so you guys would have this afterwards as well. So thank you for joining and have a great day. Thank you, Steve.
Thanks, Kara. Thanks, everyone. Take care.
Bye-bye.